Hello friends, welcome all of you. In the last video, we had discussed about the prescriptions and the parts of the prescriptions. In this video, we will discuss about the handling of prescriptions, error of prescriptions and the isotonicity concept. Handling of prescriptions. The prescriptions is only handled by the registered pharmacist, not by the non-pharmacist or any other person. So, following procedure should be adopted by the pharmacist while handling the prescriptions for compounding and dispensing. See, here the two terms are there, compounding and dispensing. Compounding means two or more drugs are mixed together to form a new product, and dispensing means just simply to give the medicine to the patients. Four criteria or four procedures while handling of the prescriptions. First is a receiving, second is a reading, third reading and checking, third collecting and weighing the material, and last compounding, labeling and packaging. We will see the first one, the receiving. In the receiving, the prescription should be revised from the patient by the pharmacist himself. Okay, the pharmacist receive the prescription from the patients only. Okay, but after receiving the prescription, a pharmacist should not change their facial expression because which gives an impression to the patient that is surprised or confused after seeing the prescription. While handling of the prescription, after receiving the prescription from the patients, the pharmacist should not change their facial expression because it gives the impression to the patient that is surprised or confused after the seeing the prescription. Okay, this is the first part of the handling of the prescription. Next, the reading and the checking. On the receiving the prescription, again, always check is that it is written in the proper format or not. Whether prescription is written in proper format or not, this is checked by the pharmacist. That is on doctor pad and check the signature, name, address and date of the prescription. In case of any difficulty in reading or any doubt regarding the prescription, the pharmacist should consult other pharmacist or prescriber. This is a part of the reading and checking. After receiving the prescription, the pharmacist check their signature, doctor's signatures, address, name, date of the prescriptions. Okay. If there any difficulty regarding this, pharmacist should consult other pharmacist or prescriber. Next part of handling of prescription is collecting and weighing the material. This part is a before the compounding of the material. Before the weighing the required material, it should collected on the left hand side of the balance. After weighing the material, it should be transferred to the right hand side of the balance. Why? Because this gives the correct checking of the weighing. This gives correct checking of the weighing of the ingredient. Okay. So for this, for the compounding of the material, the collecting and weighing of the material is should in proper manner. So therefore, before weighing the required material, it should collected on the left hand side of the balance. After weighing this material, it should be transferred to the right hand side of the balance. Okay, this is a part of the handling of the prescription. Next part, compounding, labeling and packaging. Okay, but before compounding, all the equipment should be clean, dried and compounding should be carried out in a neat place. Okay, before compounding, the equipment should be clean and dried, and this compounding procedure should be carried out in a neat place. All the ingredients should be compounded according to the direction of the prescriber or pharmaceutical art. This compounding should be proceed or accordance with the direction of the prescriber only, and only one prescription should be compounded at one time. This is compounding, labeling and the packaging. But after compounding the final preparation, this preparation transfer into the suitable container according to the size of the container, label it but for the labeling purpose, white plain paper should be used. And this container is polished so as to remove the fingerprints. Any fingerprints are there, this removed by the polishing. While delivering, while delivering the prescription to the patient, the pharmacist should explain the mode of administration, direction, use and storage. This is the duty of the pharmacist. After compounding, while delivering the prescription to the patient, the pharmacist should explain the mode of administration, direction for use and the storage. This is the use of the role of the pharmacist. These are the handling of the prescriptions part. First part is what? The receiving, then reading and checking, then collecting and weighing the material, and last part is a compounding, labeling and packaging. These are important in prescription part. So next part is the sources of error in prescription. Which are the sources for error in prescription? First is the abbreviation, name of the drug, strength of the preparation, dosage form of the drug prescribed, dose, instructions for the patient, and last one is a incompatibility. First, we will see the first abbreviation. Abbreviations present the problem in understanding part of the prescription order. Means there are many abbreviations are used in the prescription for the better understanding or time saving purpose. But if there is a pharmacist should guess the prescription, guess the abbreviation, this should not be happen again because it may chances of error. Okay, so for better understanding, pharmacists should go through the Latin terms and the abbreviations. Okay, this is the first part of this error in the abbreviation. Next part is the name of the drug. There are certain drugs whose name look or sound like those of other drugs. So one drug is similar to other drugs by their name or by their sound also. For example, digoxin and digoxin. These drugs are look like the same as well as the sound like also same. So this is maybe chances of the error. Next, strength of the preparation. The strength of the preparation should be stated by the prescriber only, and it is essential when various strength of the product are available in the market. Whatever the strength is stated by the prescriber, by this strength only, this strength is useful in the preparation. Okay, this is the third error of the prescription. Next, dosage form of the drug prescribed. Many medicines are available in the more than one dosage form like liquid, tablet and capsule. One drug or one drug is available in the many types of dosage form. So there may be chances of error in this prescription. Next is a dose. Unusually high or low doses should be discussed with prescriber because pediatrics dosage may present. So pharmacists should consult pediatrics posology to avoid any error. Sometimes a reasonable dose is administered too frequently. See, here dose. Unusually high or low dose should be discussed with the prescriber. Pediatric dose has a different, adult dose has a different. So pharmacist should have the knowledge about the pediatrics posology, means dose calculation according to the age, sex, weight. Okay, so therefore dose is an maybe chances of arising a error in prescription. Next is an instruction for the patient. The instruction for the patient which are given in the prescription are incomplete or omitted. Whatever the instructions are given by the physicians, these instructions in the prescription is incomplete or omitted. What will happen in that case? The patient cannot be understood easily. Might be their confusions may take place. The quantity of drug to be taken, frequent and timing of the administration, routes of administration, this should clearly given in the prescription. Why? Because it's avoid any confusion. But somehow if these instructions are incomplete or omitted, there are error of prescriptions may arise. Last part is a incompatibility. It is essential to check that there are no pharmaceutical or therapeutic incompatibility in the prescribed preparation. and that different medicines prescribed for the same patient do not interact with each other to produce any harm to the patient. This is checked by the pharmacist only, whether it is a there is a incompatibility is there or not, pharmaceutical or therapeutic incompatibility. So it also it interact do not interact with each other to produce any harm to the patient. Certain antibiotics should not be given with meal since it significantly decrease the absorption of the drug. This part of incompatibility may produce the error in the prescriptions. These are the errors in prescriptions. So next part is a isotonic solution. If the red blood cell is in contact with the solution that has same osmotic pressure as that of blood plasma, the cell wall neither swell nor shrink. That is, it will retain its tone and therefore the solution is said to be isotonic. See what they have given. If red blood cell is in contact with the solution that has same osmotic pressure. Before we study this osmotic pressure, we should know about the osmosis. What is osmosis? Osmosis means a solvent molecule passes from low solute concentration to higher solute concentration through semi-permeable membrane. This phenomena is known as the osmosis, and the pressure exerted by this pressure is known as the osmotic pressure. If this has the same pressure is known as the that means it will retain its same tone. Therefore, the solution is said to be isotonic. The name has the meaning the isotonic. Iso means same and tonic means the concentration. Okay. The parenteral and ophthalmic preparation needs adjustment to the isotonicity. For parenteral as well as the ophthalmic preparation, it needs the adjustment to the isotonic. Means it has the same concentration of this with the body fluids. Okay. The solution having the same osmotic pressure called as the isoosmotic solution. Again, the solution containing the 0.9% sodium chloride is therefore practically isotonic. 0.9% sodium chloride is practically isotonic, and the solution containing higher than 0.9% sodium chloride, those solution called hypertonic solution, and solution containing the less than 0.9% sodium chloride, those solution called hypotonic solution. This is all about the isotonic solution. Hope you understand this video. If you like the video, you can like this, share it and subscribe this channel. Thank you for watching. Thank you so much.